1 year of uncertainty.
It is important for everyone to remember that this is really a very rapidly changing situation.
1 year of loss.
If we have a very brisk uptake of this infection in the community, you can overwhelm the health resources. This is occurring in other countries. We don't want to see that occur in our country or in our state or in our region.
1 year of change.
We went from pre-packing 0 boxes in our food distribution center to about 1,000, 1,200 a week, and we're looking to probably increase that to 2,000 to 3,000 a week as this gets rolling.
1 year of new challenges.
In these tough times, if a family runs out of minutes or runs out of data for their cell phones don't work.
We're finding some of our students actually had to take jobs to make sure that they were making money, for their family.
Since March 2020, we've all done things we never could have imagined. The COVID-19 pandemic forced us to be resourceful.
Weekly, we're getting ideas from each other and able to make things safer for the providers.
We're taking a look back at how we got to this point.
We're just seeing the beginning of this crisis. We don't know how bad the surge will be or when this pandemic will end. So we must prepare ourselves mentally and physically to be in this for the long haul.
How we move forward.
We want to make sure that the 1A folks have the ability to get vaccinated before we put more stress on an already stressed system.
And contemplate what the future holds.
We cannot lose sight of the fact that the society that we are returning to post-vaccine rollout is going to feel very different than the end of 2019.
I'm Jackie DeTore. Thanks so much for joining us for this special edition of Fox 43 News, COVID-19 in Pennsylvania, 1 year later. Over the next hour, we'll be taking a look back at the past year as the coronavirus changed the lives for so many here in the Commonwealth. We'll hear from experts, including a one-on-one interview with Pennsylvania's Acting Secretary of Health, Allison Beam, about nursing home deaths, reopening, and now the COVID-19 vaccine rollout. First, we begin with a look at day 1 of the pandemic in Pennsylvania. Here's our report from March 6th, 2020.
Received confirmation of 2 presumed, and I emphasize the word presumed, positive cases of COVID-19 or coronavirus in Pennsylvania. Now,
First of 4, Governor Tom Wolf signing a disaster declaration as he announces the first 2 presumed cases of COVID-19 in Pennsylvania. Those individuals have been tested, and now those samples are being sent to the CDC for final diagnosis. Thanks so much for joining us this afternoon. I'm Jackie DeTore. So now the work begins to find out who else those people may have come in contact with. Fox 43's Jamie Bittner joins us now outside the Pennsylvania Emergency Management Agency in Harrisburg, where a command center is already in place there to contain any possible spread.
Those 2 presumptive positive cases were found in Delaware and Wayne counties. Both people had recently traveled, and now the state wants to find out if they came in contact with anyone else. And once they find those people, they will be put in quarantine as well.
that I'll be declaring a disaster.
A disaster declaration in Pennsylvania as 2 presumed positive cases of coronavirus are confirmed in the state.
Now, I'm saying presumed positive for a reason, because the results have to be confirmed by the CDC.
The 2 cases stem from Delaware and Wayne counties. The people involved are reporting to the state daily and being told to stay in their homes. The state says they're voluntarily doing that, but even if they didn't,
for these 2 patients, it would be illegal. We have a legal quarantine. It would be illegal to go out.
The test came back as presumptive positive Friday morning.
1 case traveled extensively in Europe, and including to level 3 travel warning countries, and did not move around in Pennsylvania upon return. 1 of the cases had exposure to a confirmed case in another state.
Now the state is working to find anyone who came in close contact with those 2 individuals to put them in a 14-day quarantine.
Right now, the emphasis of the plan is mitigation tactics to keep this virus from spreading widely.
And we are in full incident command.
The state says it's been preparing for this. A look now inside the Pennsylvania Command Center that has been up and running for 5 weeks to track the virus.
We expect more cases to be confirmed in the upcoming days and weeks. And we want everyone to take action to help prevent the spread.
Prevent the spread with good hygiene, washing hands, covering coughs, cleaning surfaces, and staying home when you're sick.
We will do what it takes to make sure that Pennsylvanians are safe.
The state emphasizes they are prepared for this and they're having daily conversations with the CDC.
So, Jamie, we know those 2 patients are presumed positive. So how is the state handling testing for that virus?
Well, the state says up until this past Monday, the only testing that could be done for the virus was at the CDC's headquarters in Atlanta, Georgia. Now they say that has changed and the federal government has cleared the way for more kits to come into the state. Right now, they can conduct about 25 per day, but they hope by the end of the weekend that will be up to 150 kits that they can process every day. Meantime, they're also trying to open up testing to commercial labs to make it even more expansive.
And we have come a long way in dealing with the pandemic since day one. And there have also been a lot of changes. Allison Beam is now Pennsylvania's acting Secretary of Health. When the World Health Organization declared the coronavirus a global pandemic, Beam was Governor Tom Wolf's deputy chief of staff. Here's what she remembers about the first COVID-19 cases in Pennsylvania and what it looked like behind the scenes.
That I'll be declaring a disaster.
In essence, it was we had done enough dry runs that we were ready for that first case, those first 2 cases to come in that night. But it surely was still, I think, a little bit of the alarming nature that happens when they actually have cases identified in the Commonwealth.
Did you have any idea what the weight of this was truly going to be?
I don't know that we were contemplating weight, but I surely know that we hadn't contemplated the duration being what we were. I mean, honestly, the fact that our teams have been in response mode for over a year, and we still have more to go, I think was one of the unfathomable things at that time, which has also made it all the more rewarding to work with a team that has stayed dedicated to a mission for a sustained crisis. I mean, that is really a distinguishing factor. When you talk about crisis preparedness, most folks are talking about days or weeks or maybe months. And I think that is something that we can't lose sight of right now in talking about this 1 year since our first case in Pennsylvania, that these teams have stayed dedicated and remain dedicated to continuing their response, not letting up on making sure Pennsylvanians are safe and pushing out that vaccine to really progress us through what remains of the COVID-19 response.
And Acting Secretary, you have kind of an interesting role here because you started at the beginning of the pandemic. You were a deputy chief of staff for Governor Tom Wolf, correct? So kind of tell me what your involvement was at that point. Were you kind of in the room where it happened? Were you involved in the decisions when it comes to back in March, April, May? We're talking business closure, stay-at-home orders, and the eventual slow reopening. Were you involved in those conversations?
Sure. So the governor's office and the Department of Health clearly required a lot of communication, which was my primary role in making sure that there was public health issues brought to the governor's office at that proper cadence, which clearly the pandemic requires quite a bit of urgency. And so there was a lot of liaising between the Secretary of Health and her executive deputy secretary and the front office. I will also note that at that time, the portfolio of agencies that I had responsibility for also included human services, drug and alcohol, aging, insurance, and all of those agencies were still undergoing their own response to the COVID-19 pandemic too, because you can't forget that this really has touched every single area of our state's administration. And so it was not just working with the Department of Health, obviously was requiring a bit of prominence at that time, but it was also making sure that other interests and other perspectives were being properly notified, communicated, and served well in thinking through all the strategic discussions with the governor's office.
Up next, Fox 43 asked the acting health secretary, Allison Beam, about one of the most controversial parts of the pandemic here in Pennsylvania, the decision to allow COVID-19 positive patients into nursing homes. First, though, Fox 43's Chelsea Kerbler takes us back to some of the major milestones of the pandemic.
365 days of COVID-19, March 6, 2020.
We received confirmation of 2 presumed, and I emphasize the word presumed, positive cases of COVID-19 or coronavirus in Pennsylvania.
The first 2 cases reported, one in Delaware County, the other in Wayne County. Governor Wolf signs his first disaster declaration.
We expect more cases to be confirmed in the upcoming days and weeks, and we want everyone to take action to help prevent the spread.
Then Health Secretary Dr. Rachel Levine tells Pennsylvanians, wash your hands, clean surfaces, and don't go out if you feel sick. March 12th, the first social distancing order in the Philly suburbs and Pittsburgh. The next day, the first COVID-19 cases reported in South Central PA, 3 in Cumberland County. Governor Wolf orders schools to close statewide for 2 weeks. They won't reopen until the fall. March 14th, toilet paper and other shortages hit a peak. Grocery stores shorten their hours and restrict customers amid reports of people hoarding. March 16th, a social distancing mandate goes into effect statewide. Many of us hear the phrase essential businesses for the first time as Philly orders all non-essential businesses to close for 2 weeks. The next day, all state liquor stores close.
Can't get away from what's going on. I mean, it is what it is. Just be smart about it.
March 18th, the first COVID-19 death reported in the state in Northampton County. Over the next few days, York, Adams, Lancaster, Lebanon, and Franklin counties report their first COVID-19 cases. March 21st, all non-essential businesses are shut down. The governor says businesses can apply for waivers if they believe they are essential. That becomes a major source of controversy in the months ahead. On March 27th, the first people from our area die, 1 in Cumberland and 1 in Lancaster counties. That same day, Governor Wolf issued a stay-at-home order for Lancaster and York counties. April 1st, that stay-at-home order goes into effect statewide as state Republicans begin to call for an end to restrictions.
Because it's going to be really hard to survive over the next 10 weeks if people can't make their own business decisions.
Frustration as PA starts selling liquor online, but demand causes the website to repeatedly crash. April 3rd, Governor Wolf urges people to start wearing masks. That eventually becomes a mask mandate for essential businesses. April 17th, the color-coded tier system is introduced. The entire state joins the red phase, where all non-essential businesses are closed and people are under a stay-at-home order. April 20th, hundreds of people, including GOP lawmakers, march on Harrisburg, demanding businesses reopen. Many are maskless.
We all take risks. That's part of living. You got to let life continue. Without incomes, without jobs, we can't live it.
May 8th, counties start to enter the yellow phase of reopening, but none are in our area. Lebanon County becomes the first to defy state orders and moves to the yellow phase on its own. It's not until May 22nd when 6 local counties go yellow. By the end of May, every county in our area is in yellow except Lancaster, and some PA counties enter the green phase. May 25th, the death of George Floyd. In cities and small towns, people rally for justice. Experts fear a super spreader event, but cases don't spike after the protests. June 5th, the first wave is over and more counties begin to go green. Every week, new counties are added. By the end of the month, only Lebanon County is in yellow.
That's what it is, total payback.
Within a week, Lebanon County becomes the final county to enter green. On July 1st, the governor issues a statewide mask mandate.
I'm sort of thinking this is until we get a vaccine. Areas where people wear masks, the infection rate is actually lower.
July 18th, PA passes 100,000 COVID-19 cases. In August, uproar over school sports. The state recommends but doesn't demand that schools cancel the fall sports season. Parents and students rally in Harrisburg to keep sports going. Overall, case numbers remain relatively low over the summer. In September, a federal judge rules that the governor's COVID-19 mitigation efforts are unconstitutional. That ruling is overturned weeks later, but restrictions were temporarily lifted. As temperatures drop, the numbers start to climb. October 28th, PA passes 200,000 cases. November 6th, PA records more than 3,000 new cases in a day for the first time. PA would pass 4,000 for the first time one day later, and 5,000 just days after that. November 25th, Thanksgiving Eve. PA has seen 300,000 COVID-19 cases and 10,000 deaths. Health officials are warning people, stay home for Thanksgiving or there will be a major spike. The state limits liquor sales and issues new travel restrictions to help slow the spike in cases.
We want people to stay at home within their household I understand that that's a tremendous sacrifice, but this is the biggest public health crisis that we have seen in 102 years.
December 5th, the worst day of the pandemic in Pennsylvania for infections, with nearly 13,000 testing positive. There are now 400,000 positive cases in PA. 3 days later, Governor Wolf tests positive for COVID-19. December 10th, indoor dining is banned and outdoor gatherings are limited to 50 people. Health leaders say what happened on Thanksgiving cannot happen again for Christmas. December 11th, there's hope. As the Pfizer vaccine is approved, the first vaccinations given out in PA 3 days later. 1 week after, Moderna's vaccine is approved. But the spike continues. December 26th, there are now 600,000 cases. Half of those cases have come in just over a month. Cases stay high through the new year with a spike 2 weeks after Christmas. January 8th, Governor Wolf announces a phased vaccination plan. Phase 1A begins with frontline workers and seniors eligible. Soon after, people over 65 and high-risk people are added. January 20th, the deadliest day of the pandemic. 442 Pennsylvanians died in one day. It vaults the state past 20,000 deaths, about 10,000 of those since Thanksgiving. Meanwhile, people are struggling to schedule appointments to get a vaccine. In February, new guidelines to get more vaccines out, but it's revealed that providers misunderstood the guidelines and used up a supply of second doses as first doses. February 27th, the Johnson & Johnson vaccine is approved, and as March began, Governor Wolf announced that those doses would go to teachers to help reopen schools, which brings us up to today. Everyone's life has changed. There's hope on the horizon, but also danger. So we go into the next unknown period with many questions. When will mass vaccination sites open? When will schools reopen in person? When will everyone be able to get a vaccine? And of course, when will life return to normal? But on March 6, 2021, just the same as on March 6, 2020, the words of Dr. Levine still ring true.
Stay calm, stay alert, and stay safe.
Chelsea Kerbler, Fox 43 News.
More than half of the state's COVID-19 deaths occurred in long-term care facilities. That is one of the highest percentages in the country. We asked Acting Health Secretary Allison Beam if she was involved in any of the decisions to admit positive COVID-19 patients into nursing homes, and if she would make that same decision today.
Remember where we were situated when that decision was made, which was we were watching Europe, we were watching countries that were having the COVID pandemic rage through their towns before ours necessarily hit, and we saw the hospitals being overrun. And at that stage, we were really making sure that our hospitals were not going to be our vulnerability, our point of having folks that not only got sick from COVID-19, but had other traumatic injuries incurred and that they couldn't seek treatment. And that is what guided a lot of our decision making at that time, including on elective procedures and the like. And so in thinking through the nursing home discharge decision, you have to remember that not only was that our goal to make sure that folks were not somehow prevented from getting the care, the necessary care at a hospital, but also that the individuals that had unfortunately contracted COVID-19 were able to actually go safely recover at their home. And for many of these folks, home is that nursing home. They are a resident of the nursing home. And so that is where they are best situated to actually recover from the disease. And so knowing that we were trying to make sure our hospitals were not overrun, but likewise making sure folks could recover as safely as possible, and that nursing home guidance that came from the federal government, and we clarified, added these additional protections to understand how to cohort safely, understand how to treat somebody safely if they had actually had COVID-19. And so we had put in place the parameters around it to do what was really in Pennsylvanians' best interest at the time to not have our hospitals overrun.
So I guess the question becomes now, we're about a year removed from that recommendation. It came down from the CDC. It was a recommendation as at the time the Department of Health and the Wolf administration decided to make that the policy and tell long-term care facilities this. Knowing what you know now, that most of the deaths in Pennsylvania were in nursing homes, would you, as acting secretary, still make that same decision?
Unfortunately, I'd have to say that is something that I hope that we don't have to make at this stage of the game, because honestly, looking forward, that is unfortunately contemplating a time in which we again are looking at our hospitals being overrun, looking at our nursing homes being susceptible to having that global pandemic actually transmitted within it. And so I think what we would have is the benefit of what we've learned now throughout the different states' responses to this question and being able to better inform any strategic decisions moving forward.
It seems like if you were in that same position at the time, not knowing what we know now, you would have still made the same decision.
We would have to evaluate at that stage. I want to make sure that I would have the betterment of all of the information that the Department of Health was looking at that time. Again, from the governor's office perspective, we were able to use the Department of Health's expertise. And I would want to do the same review and make sure that I had that same information to come to a conclusion as to what was best for Pennsylvanians.
The state legislature now wants an investigation into those nursing home deaths. Fox 43's Jamie Bittner spoke with the Pennsylvania House Majority Leader, Kerry Benninghoff, after he announced a major step that will force the state to take a closer look.
At the end of the day, we want Pennsylvanians to feel that we're a lot more prepared than we were 12 months ago. And more importantly, that decisions are being made by more than just one or two people.
Pennsylvania's House Majority Leader told Fox 43 he just wants answers into the COVID-19 response at nursing homes. That's why he said he'll push for an investigation led by the House Oversight Committee.
How long would this investigation take?
We are not putting a timeline on this. We want it to be done thoroughly. We want it to be done fairly.
He says lawmakers haven't received transparent answers on a lot of questions, including,
as of the pandemic was beginning, then Health Secretary Dr. Levine removed her own mother from one of these long-term care facilities and put her in a hotel.
Claiming Dr. Rachel Levine's recent confirmation hearings also showed death and reporting data is incomplete. Plus, he wants to know why the state decided to follow
guidance as to put COVID-19 patients back into nursing homes after hospitalization.
Why not a resolution then to overturn that order when it happened? Why wait until now to question that?
Well, as you know, we have not been very successful overturning many orders that have happened in the last year.
He says that's where the House Oversight Committee comes in, because it's bipartisan and has subpoena powers.
Who would you like to see be subpoenaed to testify?
Anybody that was in the decision-making process. We realize the governor has say in these things. We realize that the former Secretary, Dr. Levine, had say. Are they the only two people that made these decisions? I would hope not.
House Democrats told Fox 43 it's important to not only identify any missteps, but also to highlight the many things that were done right. The fact-finding process will be guided by truth and not by any false claims. Just last month, the governor said he'd be open to an investigation.
I think we're doing a pretty good job, but we're always looking for ways to improve, and that really requires that we allow people to come in and take a look at what we're doing.
Jamie Bittner, Fox 43 News.
Coming up next on this Fox 43 special report, some people who got COVID-19 have long roads to recovery. We're checking in with one of the first people in our area to be released from the hospital nearly a year after it happened.
That I don't remember being intubated or very much of that time. It's one of those things where I kind of felt like I was in a kind of a limbo, kind of dream state.
That's Douglas Dottie of Boiling Springs, Cumberland County. He was one of the first stories we brought you of a COVID-19 recovery. Dottie was discharged from the hospital in April of 2020. Since then, he's slowly recovered, but he's still not back to normal. As he tells Fox 43's Chelsea Kerbler, he still feels the effects of COVID-19 nearly a year later.
It's been nearly a year since Douglas Doty of Chambersburg was wheeled out of the hospital after being intubated during a 3-week battle with COVID-19.
This thing almost killed me. I don't think I've ever been that sick in my life.
Now, nearly a year later, Doty is still feeling the effects of the virus.
I went bowling the other day. Bowling used to be something I did a lot, and I could do 9 games in a row with no problems. I do 3 games, and I felt like I just got done climbing Mount Everest. My legs were killing me, my arms were weak, and I just felt out of breath.
Doty is thankful to be where he is now and does not consider himself a long hauler, as others suffer with more longer-lasting side effects. Doty's road to recovery, though, took months.
It took a good 6 months before I started being able to walk a couple of miles without losing my breath, getting my legs underneath me. I still have a lot of muscle weakness in my arms and my legs.
Beyond the physical aspects of COVID-19's havoc on the body, Doty is also facing the psychological effects.
The psychological parts are still there for me. I tend to err on the side of caution. I tend to, if I'm in a store with a person who's not wearing a mask, I do what I can to stay 2 blocks away from them. Things like that, where I just try to always make sure my surroundings are that I'm being as cautious as I can be around other people.
Now, nearly a year removed, Doty's received his first shot of the COVID-19 vaccine. With a light at the end of the tunnel, life will seemingly return to normal at some point. But for Doty, even as things return to normal, there's something he's learned from fighting this virus that will stay with him. Life is short, and to not take it for granted.
Looking back at a moment where I thought, honestly, I was going to die, I was really thinking about, I never got to really see this person or visit this person or go and spend time with my family. Things like that do matter more so nowadays than they, in my mind than they used to. I used to think I had time. This has made me realize that we're all mortal, and sooner or later our time is up, and we need to do what we can right now, and don't put it off, because you never know when your last day on this earth is going to be.
It's a message he hopes even people who didn't get the virus will still take away from living through the pandemic. Chelsea Kerbler, Fox 43 News.
People have become very creative during the pandemic, and that includes celebrations. This is a birthday celebration from May in York County. Cars drove through Mount Wolf to celebrate the birthday of a 2-year-old. It's just one of the many new style of parties that people have had over the past year. In March, one family celebrated a woman's 87th birthday from a distance at a York County retirement home.
She was so excited. She loved it.
Her face just lit up, and she got a little teary-eyed. It just made me really grateful to go there and see her reaction and to show how much we cared.
The family of Irene Eberly wishing her a happy birthday last year from a distance. Irene is now just a couple of weeks away from her 88th birthday. And one thing many of us have gotten used to over the past year is video calls. Whether you're using Zoom, Skype, FaceTime, WebEx, GoToMeeting, pretty much everyone spent time working or talking with loved ones using that service. There are plenty of us hoping to put the so-called Zoom fatigue aside. Mental health professionals say all that screen time can strain your brain. Just remember, when everyone can be in person again, you won't have that mute or video off button to rely on. When we come back, we take a look at the COVID-19 vaccine rollout in Pennsylvania. Fox 43 asked the acting Secretary of Health what grade she would give the rollout so far, and what happened with the issue of second doses. It's been called a shot of hope.
My family lives here, I work here, and of all the things I can think about as being a family doc, it means very much to me that we get as many people as we can vaccinated.
Many, though, have struggled to get it, with more demand than there is supply.
Just 5 minutes ago, I had someone sitting at my desk here in my office berating me about why you can't get a vaccination.
The goal remains getting more shots into arms, and
we really have to work together to make sure that we don't have people fall through the cracks moving forward.
Welcome back to the special edition of Fox 43 News, COVID-19 in Pennsylvania, 1 year later. We continue our conversation with Acting Health Secretary Allison Beam with a discussion about COVID-19 vaccines. The state rollout began shortly after Dr. Rachel Levine was nominated to be part of President Joe Biden's administration. So we wanted to know why Beam wanted to take this job during the vaccine rollout, something Pennsylvania has almost never seen before, and arguably the most pivotal time of the pandemic.
When we were speaking with the governor's office about this role, one of the things that was very clear was that it was going to need decisive leadership that could come in, not only familiarity with the team, but also knowing where this governor's principles are. And I think that that is something that I really felt like it was my duty to be able to do this for Pennsylvania, to move us forward, to allow the vaccine rollout to happen as quickly and as equitably as possible, and drive Pennsylvania really through the end of this pandemic.
So Dr. Rachel Levine was both a doctor and a health secretary. You do not have you did not go to medical school, correct?
Correct.
So what would you say to critics who say that maybe you're not the person for this job because of that?
So to Dr. Levine's credit, I think that we had a clinician at the helm of the Department of Health at a time when a clinician was absolutely necessary. I think that the role of the Department of Health, and frankly, where we are in this crisis, has shifted in its needs of leadership. And I think where we need a leader now is somebody who is going to swiftly make decisions, communicate at all costs, and make sure that folks understand how we're progressing. Because at this stage, we have an excellent team of clinicians. We have epidemiologists, we have immunologists, we have laboratorians. All of those folks remain, right? We still have the clinical expertise within the Department of Health, and I'm eager to always hear their thoughts. But we also need somebody who's going to be able to swiftly guide us through this. And that really is more, I think, appropriate with my skill set and my experience to date to be able to deliver Pennsylvania.
Let's touch on the topic of second doses. A couple weeks ago, Department of Health comes out and started to realize that some of the second doses of Moderna ended up being given as first doses, making kind of a second dose shortage for the people who were timing out to get their second shot. This also happened, the Department of Health said, they started to realize this was happening the end of January. That's right around the time Dr. Levine left, and it's right around the time you came in. Was there anything, did this second dose issue fall through the cracks and there was not enough oversight of it because of the changing of the guard at the Department of Health?
So I want to be clear about the second dose issue. While it was definitely contributed to by structural issues that were from the start of our vaccine distribution, they compounded over time and really became, I think, most evident truly within 3 to 4 days of us going public with the legislative task force solutions for addressing it. We wanted to make sure, first of all, you have to remember that second doses that come that requisite 3 to 4 weeks apart. And so when the orders so far exceeded what we were actually getting by way of our allocation, that was something that truly was recognized, quickly decided on by the legislative task force how to proceed. And we went public with the fix as soon as I think humanly possible at that point. And so really, it was, while there was a recognition that there could have been controls put in place at the very beginning to try and prevent against this, we also knew that it likely emerged, and we quickly acted as soon as it was emerging and on our plates.
So what are some of the controls in place now to make sure that's not happening again?
So you will, if you talk to our provider community, one of the things that has definitely changed is we not only have daily calls with them right now to talk through any issue that they may have, we also have very clear, explicit instructions heading their way, explaining exactly what doses are coming to their doorstep whether they are first or second doses, and when to use them. And really, it's that clear instruction that we think really needed to be honed in on so we could prevent against any of those second doses being inadvertently used as first doses previously.
As of today, where things stand, what letter grade would you give the vaccine rollout in Pennsylvania?
We know there is room for improvement. We have been very abundantly clear. Since coming in, we have not only put in place controls around the allocation formula, we have ramped up our provider communication and our communication broadly tremendously. And also we've made sure that our provider network is really concentrating that vaccine into the providers that can handle that volume. And so we've worked tremendously hard to be able to improve upon where we were even just a month ago. And we really do have to remember, we are roughly 3 months in to the vaccine rollout at this time. And we want to make sure that we don't box ourselves into doing something just because that was how it was done from the onset. We've pivoted, and we've pivoted in a way that's going to allow us to ultimately improve how quickly and how efficiently and equitably Pennsylvanians get shots into arms. And that is above all else, the most important thing is that we continue that progress, and we can't lose any of the stamina and the inertia that we've built thus far to be able to continue this, to find ourselves in a place where hopefully we've reached that critical mass of Pennsylvanians getting vaccinated and we get those shots into arms, especially anyone who wants the vaccine, we're able to secure it for them quite quickly. And so room for improvement, of course, and we've acknowledged that, but I think we're well on that road to progress.
So if you could give it a letter grade, what are you talking here? Maybe C+? Are you in the Bs? Are you in the Cs? Where would you put it right now?
So I am not in the grading profession. I would not put a grade on our letter grade on our performance to date. I think at this stage of the game, we've got to focus on forward progress and the room for improvement.
And what would you say to the people who right now say it's an F?
I honestly, that gives us even more room to improve, right? And I understand the frustrations. I really have worked to understand folks. We've had a lot of opportunities to hear from folks directly, their frustrations with the scheduling systems, their frustrations with 1A being a large subset of Pennsylvanians. And while our aims are always to make sure that we get seniors, those with comorbidities, those in long-term care facilities, and healthcare providers vaccinated as quickly as possible, unfortunately, that has meant that there's a lot of folks in 1A. And we really want to make sure that we have the ability to get them all vaccinated as quickly as possible. So I get that they have the frustration, but I would also, my message is we need more vaccine, and that is our limiting factor. And we are going to relentlessly advocate that the federal government deploy all of its powers possible in not only making sure that we ramp up efforts, but we're able to get that distributed into Pennsylvania as quickly as possible.
Coming up, we take a look at what comes next with the COVID-19 vaccine rollout and when the next group of people can get their shot. Plus, why the state is spending millions of dollars for outside help. While the Pennsylvania Department of Health is still trying to sort out the second dose issue of the Moderna COVID-19 vaccines, it hired a consulting group to help with the vaccine distribution. $11.5 million is going to the Boston Consulting Group to help with the rollout process. So we wanted to know why the state needs to pay that much money for help.
So data is a key part that they're working on. Allocation strategy is a key part that they're working on. And provider network, that piece about making sure that as providers are interested in partnering with us to be vaccinators, we're doing it in a way that is equitable and reaches as many corners of the Commonwealth as possible, but also that we're doing it as quickly as possible, knowing the demand that's so high right now for vaccines in the Commonwealth.
Some people are saying, why spend $11.5 million for this consulting firm if we can just make a full-on centralized system that may be a better approach to this vaccine rollout. What would you have to say to that?
So we're open to discussions about the centralized registration system. And I think folks know that to the extent that that technology has been successfully deployed in other jurisdictions, we're open to those conversations. We talk to our state counterparts pretty often, and I think many states have struggled to find that there's a technology that really meets the needs of their constituents. But I also want to make sure that folks understand that the registry is one piece. And really, at the end of the day, what we're solving for is really data integrity to allow us to be strategic with much broader decisions than just necessarily any sort of registry, because folks have a contemplation of that at times serving as just a list that you can get onto. I think folks have a contemplation of that serving as a scheduling system. All of that, again, providers have invested in their scheduling systems. We want to make sure that we can do that as comprehensively as possible. But at the end of the day, what we're working towards is making sure that BCG helps us with all of our strategies for allocating, for making sure the data is there, our providers network is there. And then, I feel like what I'm going to say is repetitive, but more vaccine. We continue to advocate for more vaccine at the federal level because that's our true stressor on the system above all else.
Because, at this point, we know not every single person in any of these phases is going to get the vaccine. So has there been discussion, 70% herd immunity is what we've been kind of hearing. So has there been a discussion that when 70% of the people in 1A or what was originally 1A are vaccinated, then you move on to phase 1B? Is that what those discussions are like?
So one of the things that we've really been able to use as a gauge is our provider community feedback. So our provider community is very, very communicative, and they have been able to tell us when they see those appointments not get scheduled as quickly, that's one of the true indicators that access is going to be there so folks can avail themselves of the appointment, right? And so we've been talking to our provider community very closely about how that space is going to be created. Those indicators are going to be there because to your opening point, it's hard to be able to tell how many folks in 1A are actually wanting to avail themselves of the vaccine. And we wouldn't want to put out a threshold that the Commonwealth can't achieve and then somehow block our progression through the rest of the phases. What we need to make sure of is that when we move into the next phase, it's true access to vaccine for those individuals, not just the permission that then puts stress on the existing provider network.
So there are ongoing talks about this with the legislative task force right now.
Absolutely. And data gathering. Remember, us finding out where those populations are, what the interest in those populations are. And the other technicality is that when we move into phase 1B, it's a lot about your profession. Individuals may have already qualified under 1A because of their age and their underlying comorbidity. And so when we're trying to estimate how large a group of folks would really be to actually allow them to get vaccinated, we also are really closely working with our stakeholder organizations to understand how many of their members may already have availed themselves of the vaccine, not based on profession, but based on age and health condition.
Coming up next in this Fox 43 special report, COVID-19 cases and hospitalizations continue to drop. So when can Pennsylvania reopen? The next phase of the COVID-19 pandemic is all about returning to life as normal as possible. Part of that is reopening and allowing larger gatherings. For the past year, we've heard that 5% positivity rate of cases is that benchmark for reopening. We're now inching closer to that number. So we asked Acting Health Secretary Allison Beam when we can expect to go back to normal.
Percent positivity is one of the factors, but I do want to make sure we focus on the one of the main factors, which is making sure our hospitals are not overrun. We have always, our mitigation measures in the spring, and then frankly, our pause in the winter was to make sure that our hospitals were not overrun. And so we are closely monitoring our hospitalizations, which thankfully have incrementally decreased. We're on a decreasing right there. And so cases are decreasing. We're also having our death rate decrease, and those hospitalizations are not happening that they're getting overrun or that they're not finding the right staff. And so when you have those factors, those all form a picture by which we're able to actually look at relaxing further mitigation measures. So positivity rate's a factor there, but I want to make sure to highlight the other pieces of that puzzle. I think that we made true progress this week in being able to talk through the relaxation of out-of-state travel requirements for testing and for quarantine, and then also for our large gathering guidance. Having folks be able to gather, still masked, still socially distanced, but doing it in a way that incrementally increases the amount of folks that can gather together, I think is a true indicator of how the spring is going to progress incrementally.
So we started this conversation a bit ago talking about March 6, 2020. I want to end it talking about March 2022. If you and I are having this conversation next year, what does that look like? Are we wearing masks? And are we doing this in person?
Wow, that's great to contemplate. Quite frankly, I think our strategy to date has been first and foremost, making sure the vaccine rollout is effective as possible. Secondarily, we cannot lose sight of the fact that the society that we are returning to post-vaccine rollout is going to feel very different than the end of 2019. We know that the trauma that Pennsylvanians have incurred over the last year is going to be something that we really have to work together to make sure that we don't have people fall through the cracks moving forward. And I think the vulnerabilities in our mental health systems and our education systems and our economy are really going to be where we have to focus our efforts. And so for March 2022, I am hopeful that we're able to actually be in person. I think making sure that we're doing it safely, and hopefully at that point too, we've gotten to the point where the masks won't be as necessary. But again, for that, we will follow the science, and we're the federal government, and I think those that have much more of a scientific background will be able to dictate for us when that's safely to do.
So now we look towards the day when everything is fully reopened and when masks may not be necessary. Fox 43 will cover what happens every step of the way, and you can expect more from us as the pandemic continues. Thank you so much for joining us for this Fox 43 News special report, COVID-19 in Pennsylvania, 1 year later. I'm Jackie DeTore.